All right, great. Well, let's see. I know it's a brief presentation, but I want to first start off with a hearty thanks to Cassandra Adams, Charles, and everyone, in the entire CAE cybersecurity community for giving me a chance to speak to you here today. Also to Casey O'Brien, who might be online, I'm not sure, from the National Cyberwatch Center. We presented on this topic back in October, and I thank him for the support and opportunity as well. Let's see, I'm talking to you today from the Kean Center for Cybersecurity in New Jersey. And so that's our office. Do you remember going into the offices? Well, I hope we get back there sometime. Our center, we have a great team, a real cross-collaborative team. I just want to quickly mention Dr. Driley is from our Department of Criminal Justice and Dr. Morial from our Computer Science Department. Our center is a mix between multi-departments, which I think brings a bit of a unique flavor to cybersecurity. I've got 9 quick bullets I'm going to go through, kind of like a baseball game, but certainly won't last as long as a baseball game. And I'll start off just quickly about myself. I'll give you a quick background. I want to really get into what public health research is, for those of you who may not be familiar with it, and why this topic is relevant with cybersecurity. And then I'll discuss a few topics around cyber risk assessments and a proposed cybersecurity framework that we've kind of pulled together around the topic of global public health. Really quick, I'm the director and cybersecurity lecturer here at Kean University. I've got about 25 years IT experience, and I run the gamut of software development up to running a department as well for a very large NGO. I guess most relevant to this conversation is I've done lots of on-the-ground research work in the developing world, sub-Saharan Africa, Southeast Asia, Latin America. Public health research. So what is it? So I'm here. I just pulled out a couple articles, a few things here. This is a paper, and the key thing to focus in on here is pilot trial, smartphone, and health. Okay, mHealth. That's mobile health. So I'm going to get a bit more into this. Another article I pulled up. This is around mobile health being used to monitor colorectal surgery patients. Okay, post-operative. Again, using technology in health-related research and services. You may be familiar with some of these things already. Look in the middle of the screen. You can check your heart rate. Certainly, there's lots of apps that exist, and these fall into the digital health paradigm. You're right, the bottom right there, some of you who are going onto campuses or into your facilities, you need to clear access. You might need to use some sort of application where you are answering questions about your health status before you are entering a facility. This falls into digital health. Another example, top left here, this is taking a fingerprint. It's connected to a system, a computer. This is often used in trials, clinical trials, for example, with participants to ensure you have the right people at the centers. Bottom right, given the pandemic, this is really a bit more relevant now, where we might be sending photos into our doctors or getting on a telehealth visit. This is simply taking a photo of perhaps this person's mouth, and then it's being sent in to be analyzed. Again, digital health devices. Digital health also includes things such as surveying. This is a system that I personally worked on. We created avatars, a real simple way for participants in a public health research project who wanted an avatar to be followed with them as they answered questions related to the project itself, the health-related project. So think about, you pick your own type of hair, your eyes, your mouth, your nose style. This is something that, using technology with health-related research. Another one for participants, for example, who may be semi-literate. That is, they can't, maybe they can't read and write in their local language, but they could respond to questions via audio, and they may use a color-coded box, pictures of fruit, other pictures of vegetables, for example, to answer health-related questions. Again, digital health surveying. We just heard from Dr. Chen about chatbots. Well, there's chatbots being used in eHealth, electronic health as well. This is just really quick, a photo. Johns Hopkins University. This is a project I collaborated with in Malawi. And these are some of the end users of these systems when it comes to global public health projects utilizing technology. This is probably just to make me a bit more calm and, and to joke a little bit as I'm going through these slides. That's not really a real rhino, but I did get to travel and visit the Nairobi National Park on one of these research projects. All right, back to business. Why is this relevant? Well, it's relevant because digital health mobile technology is very important for patients. It provides operational benefits. And given our current climate right now, or current pandemic situation we're in, it's even more important, this mHealth market. It's expected to double in the next 2 years to 130 billion. This is from a study from Intertrust in 2022. And that was pre-pandemic projections, right? This might be even more so now, right? So this idea of pre-pandemic, you're probably going to see this used more often as in research projects qualifying whether it was pre or post. Telehealth, no surprise here. It's up from 11% patient use in 2019 to 46%. Some of you may have used telehealth as well. But the risks are there. This is from the Verizon Mobile Security Index report. 85% of healthcare organizations acknowledged that a security breach could be serious and compromise patient care. And 37% of those same organizations admitting to sacrificing mobile security to get the job done. I think we need to do a little bit better there. This is also another study. Around 100 publicly available mHealth apps were picked and analyzed. And in this research, 741 vulnerabilities were discovered. I think we clearly need to do a little bit better. Related to COVID-19 and the pandemic, you may have heard about this. I know some of you might be from California, but there was a university working on a COVID-19 vaccine, and they were targeted by cyber criminals. Certainly with the pandemic, we have seen an increase in cyber crime and in Canada as well, a contact tracing app. I just showed you a screen before of a contact tracing app, and that was attacked, or really spawned. It was a masqueraded app that was released prior to the real app, and it spawned ransomware. Let's see, cybersecurity risk assessments. So this idea, this initial concept that we brought forward, and it's interesting because we just talked a little bit about chatbots in the earlier presentation. We had done a potential feasibility and effectiveness study in using chatbots in public health. And in doing so, we brought up the idea of introducing a cyber and other security threat concern section into publications, but to also do a small cybersecurity risk assessment as part of that research project. Many times these public health projects will have scientists and researchers from the public health area, but not, and they may partner a bit with technology people to build applications and solutions, technical solutions, but we think there should be a little bit more in a way of checking them for cyber risks. And that's where this initial concept came out. This was from a paper we had published back in 2019. Our goal was to bring greater confidence to those using a developed digital health system. We wanted to bring awareness to this idea of digital health and ensuring that the devices and software solutions or technology used were certainly minimized when it came to cyber risks. So we have now come forward. Here we are in 2020, and we just recently, this past month, had a publication around the idea of a toolbox, okay? And this is a bit of a proposed framework that we've put together with regard to digital health and cyber risk assessments. And we pulled from, there's lots of information. We know that there's lots of frameworks out there, but we wanted to get a framework that could be understood a bit more and really to introduce the language of cybersecurity for those working in global public health, especially in our current pandemic situation. So we utilize certainly the NIST cybersecurity framework. We've looked at pulling together some information as well from our own studies, and we came up with a real simple 7 step-by-step workflow that one could follow. And this is the paper that we recently just published on this topic, which goes into much more detail. I'm not going to be able to go into the same detail, but you know, if you do wanted to gather a bit more, it is available in the International Journal of Cybersecurity Intelligence and Cybercrime. So here it is, step 1. An assessment can occur at any of the potential development or activity areas of the public digital health effort. So we know that there might be projects where you're developing something from scratch, for example, or you are you're buying something, right, and you're implementing it. So there could be any different area where an assessment could be introduced. Next, and this seems so simple, but you have to have a bit of a sit down with your team. And this includes not just the cybersecurity folks and the technology folks who might be developing solutions, the computer science or the engineers, but the entire public health team to get everyone on the same page and at least talking the same language and introducing the concept of cybersecurity risk assessments. Next, we decided, and we pulled this from NIST, to focus on the identify and protect area with this population, this global health researchers, because that's an area we think that it made most sense for this team or this group. The detect, respond, recovery sections of the framework, we thought that was better served by the technology engineers and the true cybersecurity technical folks. Next, select one of the specific, and this could, you could pick from any of these areas, but pick from a unique category, one of the identifiers, and expand on that. So focus in. Again, we're bringing up the topic of cybersecurity risk assessments, so we need to probably educate the group as well about what might be some of the areas to focus on. Next, note the top 3 cyber threats or concerns related to either a remote or a local attack surface. We do this as technology people, but in partnership with the global health community, we think that's important to do. So you zeroed in on an area. Now let's list out the type threats. It could be 3, you may put 5, you might put 6. It's up to you, really. Next, this isn't anything that you probably haven't done before, but let's certainly put them into a likelihood and consequence grid. It could be of any particular design. We know there's different ways you can build these. You might want to build it with some sort of heat map, but in essence, at least put it into something that could be used to communicate with the team so that everybody could understand where the highest priority threats exist. And then based on, this is the last step, based on the solution analyzed, decide at that point what modifications need to be made, if any, to minimize threats. Again, this is bringing awareness, it's bringing the group, everyone on the same page, not just on the one side, the technology people, but the public health researchers and perhaps those doing data analysis as well. Now, then you might want to just go back to the top of the workflow and repeat it with another area as well. Okay, so that's you might get through one section. Let's go back to the top and go through the first and go through those steps again. Okay, these are the workflow steps. We just kind of outlined it in a simple diagram here. I've gone through the 7 steps. I won't do it again in the interest of time. I think I'm running short here. I think we're almost to the end. So what we wanted to do, we know there's limited amount of literature found with regard to digital health and cybersecurity. We've done some literature analysis on that. We think that there might be opportunities to explore the global public health curriculum and determine whether including cybersecurity topics might be warranted there. A campaign, considering a campaign of greater awareness to this topic as well, and looking for contributions from industry, because we know there's lots of industries working on solutions, not just those in perhaps public health research, in academia or non-government organizations or nonprofits. So it really, we wanted to say that this topic is a call to action for the global health community, implementers, and those technologists working in those areas We also, this is interesting, the National Library of Medicine medical subject headings, they did have computer security listed as a search term, but we want to request adding cybersecurity into that as well, into the medical search community. And certainly we need further research to explore this area of cybersecurity education in global public health. Okay, let's see, limitations. Well, we did only focus on the cybersecurity, the NIST cybersecurity framework, but there are others that we could have utilized. And our literature review that we did was focused on NIH PubMed, but we know there are others as well. Okay, I think I am at my time. Well, let me end by saying, since you can't hear me, thank you all for giving me a chance to speak to you. I appreciate it. I hope you have a lovely day. And any questions, you can always contact me at any time. I know we ran short here. These are quick sessions. You know, I look forward to corresponding further with this, this great community. Thank you.